Red dust on my sandals, still I walk in grace. Face to the sunrise, tears drying on my face. Beautiful ashes, I'm rising from the ground again. Dancing through damage.
Welcome to another episode of Beautiful Ashes with Auntie Mercy. On our last episode, we had Luimba Kasongo, a lady that has lived with sickle cell for 44 years. And she explained to us the challenges and the stigmatization that she went through, and that disease was discovered at the age of 6 months, when she was 6 months, by her parents. She discussed with us the journey and the challenges that she went through, even with her education. She further went on to tell us that because of sickle cell disease, she discovered a talent that she did not have an idea about before, and that is art. So she's currently running an NGO, and she's a visual artist at the same time. We have special guests this afternoon that are going to tell us further about sickle cell, as they are medical professionals. See you back after the break. Welcome back. In the studio today, I have with me Dr. Indrix Chisawa and a caregiver, Chama Nonde. Welcome to the program.
Thank you very much, Mercy.
Thank you.
Welcome, Chama.
Thank you.
It's good to have you both so that you can explain further to us concerning sickle cell disease. We know that you have a hands-on experience, and we're looking forward to hearing you explain further to the viewers concerning sickle cell disease. I'll start with you, Dr. Rex, as you are popularly known. I want you to give us a brief background about yourself and tell us about your work.
Okay, thank you very much, Mercy. Thank you, viewers. First of all, my name is Indrix Chisawa, a medical doctor and also an executive chairperson for an organization called Reach a Child Initiative Zambia that has been helping children with sickle cell disease. We are found at the University Teaching Hospital, but we are also found in 4 other provinces. We work hand in hand with the Ministry of Health in making sure that children with sickle cell disease are helped through by giving free medication, hydroxyurea, as well as also providing providing diagnostic equipment like HB electrophoresis in 11 different hospitals across the country. So that is what we do at Reach a Child Initiative Zambia. And then I think that's for now here.
Can you tell us exactly what sickle cell disease is from a medical as a medical personnel?
Okay, so I love to demonstrate because sometimes sickle cell people don't understand it. So I love to use illustration. So sickle cell disease is just a genetic disorder of the red blood cells that affect the red blood cells, or in short, it's just a disease that you are born with. You inherit it from both your parents. Red blood cells are blood cells that carry oxygen in the body. And then so you can see normally the red blood cells are round in shape. And then when somebody is born with sickle cell, this round shape, and then they always flow smoothly in the blood vessel. And then, but when somebody has got sickle cell, you find they change the shape to becoming like a sickle. Muchinyanja makamba chija chijeko. Kachamaya maju yako mauzu chija, so yama chinja mbwankala kwati nchi siko chijeko. So these ones, you find that they won't flow properly. They will be able to, they will block their blood vessels, and then hence causing what you call sickle cell crisis. So in short, that is what we are looking at just right now. So in short, sickle cell is an inherited blood disorder born, that one is born with from, I think that's, yeah.
Would you say it's infectious in any way?
Not really. So why I say you are born with, how you are born with sickle cell, you are born with sickle cell because you get it from both parents. It is passed down. It's genetic. You inherit it from both your mother and father. So as you can see here, we've got how you get sickle cell. So it is not an infectious disease. It's not contagious. And then also sio loyal. Because wanamulowa omwana ubadwa nayo choka udwa mai wako na watate wako sign bafunika banaka gene. So remember na it's a genetic. So kaliko kena ka gene kana manikati menso yako wena ngama nkana menso ya blue, wena ngama nkana menso ya nasisi, wena ngama skin kwati no fipa ibangu na osweta ewe. So na hivi magazi na hivi ama fuliko nkala yana ma genes yana nkala ti ma blood cells yankale bwanje yankale round. So wena ngwa manje ba mai wako na tetera kama karingako ka gene kenangu kama blood cells kuti ete bwanje ka half. So pati ni half. So mapeti muntu waliko na ka half kama ka sickle cell na wako ka half. So they are called traits. But you be so nekela. You cannot tell whether they are carriers. Okay, so they are called carriers. So both the mother and the father should be carriers. Then they pass it down to their offspring. That is the most important thing. So you are born with it from the time you are conceived up to the time, So this is how. So there's a chance, because you can see this is AS. So meaning that the father is a carrier, and also the mother, she's a carrier, and then they have children. For every pregnancy, they will have a probability that this child will be born or will just be normal, no sickle cell. And then there's another 25%. There's a 50% here, 25 plus 25, they'll be carriers. And then there's another 25% that somebody will be born with sickle cell. So it is for every pregnancy, Messi. So you find that when one is pregnant today, there's a probability that there's a 25% that this family will have, this family will have sickle cell. And then this child will be born with sickle cell. So that is what we have here. So it is not contagious. It's something that you cannot get through shaking hands. It's not something that you can be bewitched or something like that. Yeah, sure.
Are there different types of sickle cell?
Yes. We have different type of sickle cell. So in Zambia, we're just going to dwell much in Zambia. There's what we call, so sickle cell disease is just a blood disorder. It's a group of disorders of what we call the red blood cell, the hemoglobin. So in short, in Zambia, what we have is not sickle cell disease. We call it sickle cell anemia, which is SS, which is the most common and more severe type form. So there are other forms which we call sickle cell SC. So it's just a genetic. So I don't want to go into the genetics where we say, oh, there's a gene that is just that has somebody has inherited that is different. So they're different form, but we're just going to focus much what we have in Zambia, which is called sickle cell anemia, which is SS type, which is a severe type here.
Okay. Can you simplify what happens to the blood cells in someone with the sickle cell disease, just for our viewers to have an understanding?
So I am using these ones. So you find that when somebody has got sickle cell disorder, there's a to those sickle cells, the normal red blood cells, as you can see, they flow properly here. And then when you have got sickle cell, these sickle cells, they cannot flow properly, and then they end up blocking the blood vessels. So when these block the blood vessels, you find that, as you can see, block blood flow. At that point where they will block, for example, if somebody has got a blocked blood vessel in the hand and every part, the person will have what we call a pain crisis, because in that place, when you're blocking it, like the blood is in dark. So for example, you're blocking up, kubaba, or sometimes blocking chest mubaba, blocking my blood vessels mala katabwanji blocking yatabwanji mubaba mumala, and then na kumusana pali pons pa kai blood cons. Sometimes blocking na ku brain muntu yatabwanji ya blocking. So the most important and then get my stick blood. So sickle cell yama blocking ama blood vessels, and then futi sema nkala madezi yambili maningi normal red blood cells yama nkala 120 days, but my sickle cells yama nkala less than maybe 20 to 30 days. So yaonongeka fast. So ndiye hapa mwaona yaonongeka shengati yaonongeka hapa, so meaning that uyu mwana yakanongeka fast apesika ankambanji amboneka manje na chane na anemia, because this siambili maningi muchane mumubili mwayenje bamenyali. So hapa nje mwaona manje ambo aonekera manje na mubonzo ambira kati viva. So chakuru maningi musiko cell chamenti kamba mwantu mankana pain wajona nkako what you call sickle cell crisis, pain crisis. Wajama wanankako na bana wanankako na sickle cell, and then futu wankako tina bana wamakamba sickle cell pain ya sickle cell ima baba kuchina labor pain jeba wamapitamu bana jeba wamakambila wantu wana balako, and then futu atabwanji wanako na sickle cell.
What are some of the common triggers that can lead to a crisis? You've mentioned a crisis. So what commonly triggers that?
So let me, before I go to the triggers, since I'm here, I can just say the simple signs and symptoms. Mgaze bwanje uti mwana uyu.
Yes.
Ana sickle cell, right? Chamfunika kuziba, chamfunika kuona. Number one, mgaone mwana uyu, ama sometimes akabado, ama below 6 months or sometime. Ama onika mwana atabwanje ama mbabo kuvimba manja na mendo, mgaone mwana angabe mupen alila cha ben. So jampa mwana so kaisa akamba. So mzana be manja na mendo kuchiko hand foot syndrome or dactylitis pani vimba alila. So nge pen ama nkana olo sometimes wina ngumumala chabe wakakula sometimes katima misa ifeko hospital. So ukambunda bakula wamalila pain chabe kama crisis walila. So ni pain crisis. Number 2 jeta kamba swelling manja, and then sometimes na tumdwadwa pafupi chabe ma infections because spleen sometimes imaonongeka musiko cell, and then wamkala lema chabe so nekela manigi mushe wanika fatigue because ya anemia and then futi because we are panicking fast ma red blood cells momoid. So ijama wamatali substance mankala ya yellow makamba bilubin. So wanika menso ya branji ya yellow jema dengesa, and then manje na kukula sometime because ya mneswakti oxygen senda mushe na kukula so kula mushe fast kwa jibani madidi banza and then manje na meat kapena kuvonema veda maningi ama inkala maningi blocked blood kwenda kuchanchi brain imatabwanje, they end up having a lot of headaches, and then also like I said in the stomach. So in this regard, we find that what can trigger a child with sickle cell to have what we call my pain crisis. Number 1 chinchima lengesa ni kapena kapena months wakuma maningi months dehydration kama wakuma dehydration can trigger a sickle cell pain crisis.
So they need to constantly be hydrated.
Constantly rehydrated. I think Chama will talk about that as a caregiver. And then also they will have makamdoa maningi. My infections can also trigger machani ma pain crisis na crisis. And then futi na kukazizila foot. So extreme temperatures, whether cold or hot, they are not supposed to be exposed to the cold. So they are supposed to always be in. So ngakambai, so hapa dehydration afunukuma maningi manzen. Kapena ma infection you need to wachingiriza kujava mushe vichingiza gani kuma infection na mama nkwala mushe and then kama ni cold they need to wear warm clothes then. And then kapani kota bwanji so kama stress so mafunika maningi kwa maningi mwaji stress maningi na hivi because stress is what bwanji that trigger maningi crisis na kwa demesa maningi. So what we are saying in schools they are supposed to do to light work so that they are not really stressed a lot. And then also na kwenda maningi madupili kube maningi oxygen na hivi then sabwanji is that ngati what bwanji it when stress what then futu kapia fiti maningi hotness because wamapiwa maningi again uzalingi sauti ngenemo dehydration na wewe bwanji wapiwa maningi so na kwebe so in both circumstances cold and hotness will trigger the crisis. So in short these are some of the triggers of the pain crisis.
Okay.
Yes.
What kind of hospital, the hospital care, because I know that I learned even from what Wimba was telling us in the last episode that there's often going to the hospital, all the time for checks and because of the pains and everything. What should people expect to the kind of treatment when they go to the hospital? Because sometimes you'll find that if people are not aware of the costs that are involved, because there are different tests that are supposed to be done. What should people expect when they go to the hospital?
So first of all, sickle cell is a kind of disease whereby as a mother or as a family, when a child has got sickle cell, they will have a lot of frequency of pain crisis. So they will always be going to the hospital in and out. Sometimes we can keep a child in the hospital 1 month, even less than that, or you can have a crisis. Today you have just discharged a child, then tomorrow you go back, the child they will have. So you find that you have what you call multiple hospitalization depending ya muntu amene na sickle cell amene ilili bamasiyana wena nangu soma nkakona hospitalize wena nangu but bambiri sickle cell ni in and out of hospital ene nje bamankalira. So ukaenda ku hospital mafunika number 1 bakaona ba doctor mwana first kwa kama crisis first mafunika wawazia nchancha dengesa uyu mwana kutankana chani na crisis. So because mwana kafika ku hospital ni emergency kafika pain for crisis. Number 1 chachi mafunika tachita kwa hospital first as doctors we are supposed to treat the pain first. Within 30 minutes uja mwana afunga tabwanji apasa manko ya chani ya pain to minimize pain because the child is in pain. Amalila mwana mungabe chifundo zona ka mwana kalila zona wafika mwad ba mwana wachoka kuja tomvela mwana alila uyo odo bakulo balila because the pain is so intense. So once they reach the hospital we are supposed first as doctors to take that as an emergency and make sure that pain has been relieved. And then also we put because remember to sickle cell sometimes we also give a lot of fluids so that jamwana nkabwanji rehydrated so that kapena sometimes mukawan blood flow itebwanji ya flowing mushe ma blood red blood cells ya itabwanja. So tima funata. And then number 3 number 1 first pain, number 2 fluid, number 3 man tambotamanja vama test tamaona uyu mwana tatenga ko what we call full blood count kama na problem chest atako chest x tachitaka onabona. Those are some of the things, but the most important thing that we talk about is the daily care that when we discharge this child, what medication does this child take at home daily? So at home every child with sickle cell is supposed to take at least 3 on a daily basis who are below 5. They're supposed, number 1, to take what we call PNV, 2 times daily, below 5 years, because sickle cell, the people with sickle cell don't have a problem with their spleen. So spleen helps in the defense of my bacteria.
Okay.
So sometimes the sickle cell patch spleen sevenza mushe. So we are supposed to give what? We're supposed to give them PNV every day on a daily basis, and then 2 times a day. And then also they're supposed to take what we call folic acid. Folic acid, it helps like a vitamin, so to say, to help to what? To make new red blood cells. Then there's also a drug. So there's a drug called hydroxyurea that helps to reduce umwana kankana na sickle cells. Hydroxyurea imalengeza kuti papango ma red blood cells yamesa scoring yamesa ngashite sickle. Yeah, a different type of what? Red blood cells. Yeah, then so minga kankana type ya red blood cell inango. Amatabwanji mwana uyu amatandizwa maningi. So but hydroxyurea ngambo ipasa only angamwana kankabwanji pa 9 months and above. That's when you start giving what? Hydroxyurea every day. It got to say, let me just laugh it out. It got in my ARVs ya mchani.
For 6
it got in my ARVs. So akayama mwana afuni katabwanji ayamila twine apitiliza. And then na PNV na eva kumwa na chani na folic acid na eva afuni kanayo. And then pa weekly mwana mafunika tenga kai bama kama na my infections. So so PNV machingiza my infections.
Okay.
Not to trigger machani a crisis. Again, food could call malaria food. Na hivi malaria na hivi matabwanji imata trigger machani my crisis. So we give them what we call Delta Prime weekly. Afu nikakuma mwana kama mwana mamsakira pa Monday, every Monday munga mumpasa Delta Prime. And then sometimes kama anje mankwaya afu nikakumwa yani ayadi 4 je combination ya mwana wajani ya sickle cell yani. And sometimes kama ningina severe anemia kuchani kuja ku hospital. We also transfuse transfuse, and then futi mwana mafuniko nkala fully vaccinated, because vaccination also prevent machani my infections. So mwana mafuniko nkala fully vaccinated. And then kuduwa jawena ngubana tumapati wakankala akapitira 5 years, below 5 years PNV timadeka kwa pass after 5 years. But kuduwa ngupata chosa spleen. So wamafuniko kumwa PNV for what? For life. Ndichi chikuru maningi chamene tuonapo, but chamene naibapo maningi chikuru maningi. So most of the time sickle cell imambo shita appear one after 6 months. Because before 6 months amankada na red blood cell ima bachingiza ya mumala. So after 6 months, but benda ngoma remember fast, but mostly remember after 6 months. But anje mankwara tinga tabwani tinga pasa after 6 months ikabita happy ikambonesa manje ichani sickle cell manje mwana bachane bana batu.
What advice would you give to people that are planning to get married concerning screening for sickle cell disease? How know your sickle cell status?
Know your sickle cell status. Manchester kambila sickle cell ichoka mulwa ndani mwa mai na watate. And then why sickle cell kwati se mu Zambia muno nyambiri maningi chifukwa bantu maziba chani status yao ya sickle cell kuti ni carrier or si carrier. Because carrier sama tabwanji sama oneka tiungazia tu ni carrier na oneka sama oneka pa menso. So you only know when utabwanji before you marry. So we call it premarital counseling, or before makwatirana pa jamuka mwatabwanji mwanda ku counseling. This time in other countries like Nigeria, it is mandatory before people marry. They should be able to do what? To know their sickle cell status. Like TD now, this time around you can now check. Unaweza kufanya iwe unapimisa HIV. But wama wala kwa chinchikuru maningi sickle cell. So funko manje this time around what we are advocating, we are saying tufunga tafuta kwa vintu vingati vivi imo mnapimisa HIV, tunapimisa nanga sickle cell mnapimisa ile bwanji. And then maziwa chili bwanji sickle cell status ya bajabantu mufunga mwenda payani panyale swati hospital maziwa tiaba if either chili AA means bali normally billet swa carrier bacha be normal or ndimo ba AAC or ndwa SSN. So meaning that command we carrier ufuno kwatira wazia ineni kwatira na muntu wa bwanji istika mbati you have to plan your family. It's good for family planning
yes.
for future, because sickle cell kwamba vache nyo dula disease then vatakambira you are in and outside what hospital na mankwala futi ama pesika nyo dula sometimes so you need to know okay it unaonikwata na eve no muka shana we oro ine sakwanisa kusunga na banja ya just in case tankayawandi takwata na pesika so is even kama mukati wa wa perfect marriage ya prevention ya sickle cell mpati mundu mukazi ni na kwata na wa meaning ati pribe mwana wa sickle cell muchani mu familia polo muntu amene ali nomo akwatira mukazi amene ali carrier bazanka na mwana ali be sickle cell bazanka be na wana wako na ma carrier then bantu akakwatana wa ma carriers kabeka palipo 25% nocha za kwatira naye wazapezeka mwana anachani ana sickle cell and then akakwatana wekaweka na chani pali 50% pazapezeka timwana zanka bwanji inayo napo muna mzambi whereby hospital wazia awa uyu mzimai ana sickle cell but because of tunapimisana na mbambo pati iwe mbambo kasi na hivi ni karia so pati wakana na mwana ana sickle cell pati ujamai akala mu crisis ata mwana ai mu crisis papa na aimbekeza mwana ai mu crisis na hivi akala mu crisis so matumzati mwapezeka mai bake bali mu crisis na mwana ai mu crisis so it's very important that people should do what should know their sickle cell what status because it is a burden not only for the family not only it's also a burden for the country because the country we also need to prevent this because for the future generation because mwana amavutika maningi it's better because they say knowledge is what is power. So it's better what you're getting into because also are you going to afford because also sickle cell imalengesa tibantu wa Zimbabwe wambili wamatawa wazimai bawo kapita mwana na sickle cell ana sickle cell tava mdali because uyu muntu zinakwanisa pangunongono ali hospital kama mwana kali fragile maningi pati na bakuja vita bwanji bakwanisa because bampati uyu family mozo na bana sickle cell wangati batatu or babili so it's very important that people should know what their sickle cell status before they marry and then also as parents mwana kabadwa ama punika mwapeka what you call newborn screening kuti mwana pampa yakalibe kubadwa yatu mwana waziratu mwazimene ndiba mfunika kuziwa ati aba mwata bwanji abadwa yatu ndechikuru maningi chantingwa chimalangiza ati we need to prevent. Prevention is better than cure. We are encouraging people that people should know their sickle cell status out there because number one, just to make a joke, not pattern. That's why nikamba chinyanja maningi. Sickle cell iko na bantu bakuchipata na mabemba na baku northern kuja kwanza malaria maningi so the reason why sickle cell iliko it is just like the body was just trying to protect itself against malaria. So where there's a lot of malaria that is where also makali wambili banewali so ukamkwatira kamkazi kuchipata ukamkwatira oneka manayo kuchipata ukamkwatira kamkazi kuchibemba uniko kwa pimisa first wazia akali nayo onofanya wazipimisa kaidi kamene depends kama ningi but right now it is now because of intermarriage a lot of intermarriage now we cannot tell but right now the part that has got a lot of sickle cell in Zambia is the northern part, eastern, northwestern because of that belt. So that is people as we are getting married our goal is that we should be able to know our sickle cell status. That's the message that I want us to know. That's why I have a t-shirt natawe know your sickle cell status.
Thank you very much, Dr. Rex, for explaining in detail. And now we move to you, Chama Nonde, as a caregiver. Can you tell us your role as a caregiver for someone living with sickle cell disease?
Thank you so much, Mercy. My warrior is under 5, so I'm a caregiver to a toddler. And my role is really hands-on. I have to ensure that they take their medication daily on time. I have to ensure that he's well hydrated. He did mention hydration is very important, as well as a balanced diet. They have to eat a lot of fruits, vegetables, to help with the building of the blood. So you have to ensure they eat greeny leafy vegetables such as katapa, spinach, chibwabwa, kalembla. Those are our home, they don't have to miss at home. and also to ensure that you don't stress them. You know, you create a very good environment for them. Yes. So really, that's what is involved as a caregiver.
Okay. What kind of support can families and communities provide to patients at home?
One of the support is understanding as well as knowledge. I think with families, they need to be educated. They need to learn about sickle cell. That's the only way you'll be able to offer help, if you have knowledge about the disease. So with my family, they are very aware of the disease. When I go for workshops or when I go for checkups with my son, whatever new information I receive, I come and teach them. Yes, because there are times where I'm not home. My nieces, everybody should be able to care for my child.
Yes.
They know he's supposed to drink water. They know how much water he's supposed to take. They know the medication that he's supposed to drink. So it's important that you educate your family members. It's also important that the community learns about sickle cell. They learn about the medication and all the do's and don'ts. That way they will be able to support our warriors. Yes.
Okay, so what you're saying actually is that it helps with family, with everyone gaining knowledge, more knowledge about this. And in our day and age now, we even have internet, and we can research on to get more information and have an understanding. And I think there has to be also an element of a lot of love and care.
Yes,
and
exactly.
compassion. So from your experience, what daily care routines help in managing your child's condition? Because like doctor was saying, there's a lot of pain from time to time. So with that information, how do you help? How can a child be helped in that condition?
You really have to ensure they're taking the medication. I think the key things is medication and hydration. These are very, very cardinal. And, you know, like he mentioned, anything can trigger a crisis. So the child can just be playing and all of a sudden they have a crisis. They're in pain. So, you know, you need to be ready. You need to always seek medical attention. I think he mentioned some of the things that you really need to be observant. With my toddler, he's an active child, but I'm very observant. When I see his moods, you can tell that the mood has changed, their energy levels have gone down, their temperature, all those things alert you. So you seek medical attention as soon as possible. And that way you're helping them.
Are you easily able to access the medicines? Doctor did mention that it can be quite pricey. How are you finding it for you?
It is very pricey. Sometimes there are shortages at our hospitals, especially the main medication, the hydroxyurea. That's the main medication that they're supposed to take. The one he said is the ARV for sickle cell. That one is very important. They're not supposed to miss that. And there are shortages sometimes, and it's stressful. You go to the hospital, they don't have hydroxyurea. So you can access it if you're registered with NEMA. Yes, so you can get it under the NEMA pharmacies, but in the rural areas, even just here, it's very difficult sometimes. There's shortages and it's very expensive.
Now, if there's shortages like that, what do you do? How do you manage the situation?
You have to find it yourself. Yes. You have to find and buy from these expensive pharmacies, yes. And now imagine for those that can't afford, you know, sometimes you don't have money because like you said, sickle cell is expensive. Yeah.
You did mention some foods. You said especially vegetables. Is there anything else apart from the vegetables, the dietary needs that can be added to what you mentioned apart from just the vegetables?
The normal balanced diet, really. Yes, a lot of vitamins, fruits, vegetables. They just eat normal foods. We just ensure that the vegetables, because of the blood, yes, so you have to boost their blood. So you have to ensure that they're eating foods that will boost their blood, as well as to help prevent infections. So you have to ensure a lot of fruits, milk for bones, healthy bones. Yes, so you really have to be very intentional with the foods that you give them.
And getting back to you, Doc, just for a minute, because we're talking about the foods and in adults, would you advise, because when you look at the social lifestyles, there's a lot of people believe that most people believe that to have fun, you have to take alcohol, they want to party, they want to do things like that. And for a child that is growing up with sickle cell disease, they want to be like their friends. What would be your advice, even in adults that have sickle cell disease with alcohol?
Thank you, Mercy, for that question. It's important. I'll just go back to the triggers of so alcohol and substance abuse in sickle cell is not really a good thing because, for example, alcohol already leads to dehydration. You know, when you are when you drink a lot of alcohol, you still want to take a lot of water. Now imagine we are saying sickle cell dehydration triggers a sickle cell crisis. Now imagine you are taking alcohol. So we are saying sickle cell, we call them warriors. Warriors should not take alcohol or any illicit substance abuse, like smoking, all that can also damage the blood vessels and other things. So really substance abuse and alcohol abuse is not a good thing in sickle cell and other something, or maybe also, what can I say? The kind of life where it then, let's say how can I put it? I don't want to use a lot of, no, what I want to say was, probably, be careful, like catching STIs, where you have got a guy, you have to be careful as a warrior so that you prevent yourself against HIV, STIs, gonorrhea, syphilis, and other things. So we need to be careful as we grow older, okay? Because you don't want to live like any other. You need to take care of yourself as you grow older, because that is your role as well. As you grow older, when your mom and dad will not always be there. So no alcohol, no careless life in terms of going out, sleeping around, where you can expose yourself to infections, as well as substance abuse. That is my take here.
Thank you so much. Back to you, Chama. What challenges do you face in caring for patients, especially emotionally and socially?
I think, like Doc mentioned, sickle cell is sudden, so emotionally it's draining, especially being a caregiver to a toddler. He's not at the age where he can express himself fully.
Yeah.
So there's unusual crying, maybe in the middle of the night. He just starts crying. That's very draining,
Yes.
but the support is there. Mentally it can take a toll on you, in and out of the hospital. Financially, there's just so much that is involved with it, with sickle cell. But we do receive support even just among ourselves, caregivers. We do have a support group where we encourage each other, we learn from one another, and just family support as well.
Okay. You talked about sometimes in the middle of the night, a child wakes up and is crying. There's so much spiritual awareness in Zambia.
Yes.
I'm well aware of that. And people now start thinking, a witch visited. My child was crying the whole night. Vanamloa. There are a lot of myths and misconceptions concerning sickle cell disease. Could you address that, today, so that the viewers out there can have a different perspective? Yes.
So thank you for bringing that out. There's actually a lot. I think the main that we receive is mwana wa sickle cell sazaka kula, sazaka pita 5 years, nchamwalila. Those are the myths that are surrounded with sickle cell, but they do grow up with the proper care, proper medication. They do grow up. I think another wonderful example is Wimba that you had. She's 44. So that's proof that they do grow up beyond 5 years. They grow up. Barakula, even as old as 80 years. Barakula. I think we've got an oldest warrior that I know who's in 80s.
72.
72.
And Auntie Kale.
Yes.
She's here in Zambia?
Yeah,
Yes.
she's there.
Oh, wonderful, wonderful. What practical steps can caregivers take at home to prevent a sickle cell crisis?
Ensure that your children are well hydrated. They're not exposed to extreme cold or hotness. They're eating a balanced diet, nutritious food, lots of vegetables. I know children, even older ones, but we need to force them, yes. And just emotionally support them, you know, give them the love and care. And when it comes to love and care, I'm not talking about being pitied. No, let's not pity them, you know. We want them to enjoy a normal life. Yes, so they just need discipline for the older warriors, you know, discipline. They need to have that discipline in lifestyle, to know their bodies, to manage their medication. That way they'll live a thriving life, just like all of us. Yes.
So we need to treat them like just normal people,
person.
and because sometimes they suffer a lot of stigmatization and rejection, so we need to extend, you know, our hearts and love and care to them. Dr. Rex, back to you. Can a person with sickle cell disease conceive properly?
Absolutely. They can have children, but that pregnancy need to be taken care of, has to be under monitoring. Like I said, there are some people in my preamble, I said there are some people who have got sickle cell, they have given birth, and then they've also experienced labor pain. They're saying the sickle cell labor pain is more, the sickle cell crisis pain is more painful than labor pain. So we have seen people with sickle cell becoming pregnant and having children. Yes. So it is one of those. So thank you very much for having us. And then as we are closing, I know we just want to thank you for having us. And then also thank you for our sponsors, like people like Yash and other. So we call upon other people to come on board to support sickle cell, because sickle cell doesn't have a lot of support out there. So we want people to support companies like you also, and then to come on board so that we work together with the government, partner with the government, Ministry of Health, so that we've got all the medication we need, and then people receive the support they need. So like that's what we are asking, that let's come together and fight sickle cell like we have fought HIV. Because everybody knows about HIV because they have received a lot of support. So even sickle cell, we have a lot of people with sickle cell out there that need support. Then thank you.
Thank you very much, Dr. Rex, and Chama, thank you so much. Viewers, there you've heard for yourselves. Mwandela, kuti sickle cell, si mulibeva, kuti somebody's been bewitched, and it's something that can be managed even from home. And the hospitals are there to help you, and there are caregivers and support systems out there that can help you. So this is the end of our episode, and I look forward to seeing you next week on another episode. And please follow us on BMTV channel 114, on Topstar, on YouTube as well, and on Facebook, on Instagram, and follow our WhatsApp channel, BMTV channel 114. Bye-bye.
Red dust on my sandals, still I walk in grace, face to the sunrise, tears drying on my face. Beautiful ashes, I'm rising from